You're joining award-winning podcast host and best-selling author, Dr. Justin Trosclair, as we go behind the curtain and talk to doctors and experts about their specialty, marketing, and home life balance. Let's hear a doctor's perspective. Welcome to a Doctor's Perspective podcast. This is Dr. Justin Trosclair. Today's episode is going to be a little unique. I'm going to do a solo episode. I'm going to talk all about scoliosis. I'm going to cover pretty much two different presentations. One's geared towards professional doctor audience, and the other is more for patients and those who want more information about scoliosis. So I'm going to go pretty deep in some areas about what is scoliosis, how can you screen for it at your house. There's a simple app for that, as well as just 5 or 6 different things you can look at. So we'll cover that. We'll cover the different treatment options, the major one being the Scoli brace, its effectiveness, and compare it to the regular kind you would get, and the Scoli roll, the device you lay on. And then, of course, as a chiropractor, targeting certain muscles with massage and adjustments, whether it's manual, snap, crackle, pop style, or with the instruments where you just lay there and there's no popping. We also have a unique kinesiology taping method that we can use as well. And we'll go through all of that later as far as what's available. In this clinic, we see a lot of different types of people, from kids to adults, the elderly, and they come from all over. So some people can come in once a week. Other people, they don't have that option because they just live too far away. They're just here for a brace. One of the ways patients find us are by referrals from other chiropractors, physical therapists, and surgeons. And pretty much those referrals, you come in, fit you for a brace, and we do follow-ups with that. But I don't actually treat you on an ongoing basis like your local doctor would. So let us jump in. Of course, scoliosis, it's a curve. It can be in the thoracics, which is where your ribs are, your low back, which is the lumbar. And typically you either have 1, 2, or potentially 3 curves. Okay. Once you have it, it typically will get worse. And it gets worse as you grow. It's like that growth spurt kicks in, and then just physics doesn't allow it to go straighter. Typically, it just kind of gets worse. That's when you're a kid. When you're an adult, typically it's, if you didn't have scoliosis as a kid, then it's some kind of degeneration in the spine, and it can really kind of collapse on itself. Not fully, but definitely gets worse from like a 6-month to even a year period of time. One of the things we're looking for as far as an x-ray, you can see the curve, but we're looking for rotation. So in the middle of an x-ray, there's a little V-shaped white spot, and that's the spinous process that you feel if you're touching your back. Well, if that thing's rotated, that's how you know you actually have a real scoliosis. If you have a curve and those things are still straight, that means it's a postural thing. And that's when massage, adjustments will take care of it. It's kind of like a muscle spasm type of situation. So that's not a real scoliosis. So those are curves that we can definitely go, wow, it's 10 degrees. Now it's 0. And typically there's pain involved. So come in a handful of times, your pain goes away. If you were to re-x-ray, that spasm's gone. So the curve is improved as well. So who gets scoliosis the most? Girls between the years of 10 and 12, and boys between 11 and 13 years old. You can get it as a young kid, like 4 and 5, but those are pretty rare. Also, boys get it less often than girls. And so if you're a boy who has it, we're definitely looking for any other red flags that may occur. If you have a left curve versus a right curve in the thoracics, again, where your rib cage is, then again, we're looking for more red flags, like potentially a cyst in the spine or something going on with like C1 brainstem area. And if we have any reason to suspect anything, then we'll probably order an MRI and find out if there's anything in there that would be the cause of the scoliosis. But most of the time, it's called idiopathic. It means we don't know why you get it. One of our favorite sayings is, large curves were once small, so treat early. To me, a wait and see approach is not great. Wait and see what? If the curve gets worse? Of course, it was 5 degrees. In 6 months, it might be 10. Wait a year, they grow. Uh-oh, now you have a 20-degree curve. It happens. So what are we waiting and seeing? So my thought is, I'm not saying you got to get a brace first thing, but start getting some treatment and get some work done, especially with the Scoli balance and the exercises that you give, the 3D overcorrective, postural specific scoliosis exercises. That's a big thing that you can do when the curve is really small. Scoli balance, in my opinion, it takes the most common scoliosis exercise programs like Scroth, which is heavy on breathing, CS, and Clear, and a few others. And if you look at these techniques, there's a whole bunch that you can do. But in a clinical setting, when you're trying to teach somebody, there's going to be a small amount that you actually use on a regular basis. So this technique pulled the best parts of all these different programs, created their own system, and that's where we got Scoli balance. So it's a very practical way to teach exercises geared for scoliosis, geared for correction, and uses the research, the best clinical guidelines from SOSART to get the results. But let me get back to it. If it's less than 10, typically manual therapy, exercise, adjustments, we can do that. Curves 10 to 25 degrees. This is when you're going to be looking at a brace if you're trying to be aggressive and actually take care of this while the spine is still flexible enough to make some big changes. And of course, the exercises and everything else. If it's over 25 degrees, up to 60 in the thoracic curve, or 20 degrees up to 50 degrees in the lumbar curves, bracing is pretty much anybody's going to recommend that. Whether you're going to see a chiropractor, you're at the hospital, that's when it's super clinically necessary to wear it. And then anything over that, over 60 or over 50, it's more of a surgical consult. Every now and then you'll have someone who's really doesn't want to have surgery. And so they have to sign like a consent form saying that I understand the risk and there's no guarantees that any brace will take care of it enough where you won't have problems in the future. So that one, definitely we're sending you out, having a consult and making sure you're making the right choice. Nobody really wants a rod in their back, but sometimes it's inevitable if you catch it way too late. Some of the things you can look for when you're seeing if your kid or yourself has scoliosis is, the shoulders are uneven, one hip's higher, you bend over and there's a hump on the back on one side or the other. I'll go a little more detail, but that's just generically what you're kind of looking at if you see yourself in the mirror. Basic stuff, 2 to 3% of children aged 10 to 15 years have scoliosis. When it's 11 to 14 years of age, the prevalence will increase because they grow rapidly. Yes, it can run in the family. So if a sister has it, maybe check out the other siblings as well. And believe it or not, the population over 60, 30% of those will have age-related scoliosis. So they may not have had it as a kid, but they get it from being old and their spine kind of getting arthritis and degeneration, and they kind of lean over to the side or they hunch over. Well, we know if you're hunched over and leaned over, you have a more prevalence of having pain. It could be back pain, pain in the front of the leg, overall balance issues. So you may find like grandpa might be stumbling and maybe falling. Well, but you put them in a brace, straightens them up, gets their center of gravity better, less chances of falling. It's a good thing. So when we're talking about the curve of the spine, yes, it's curved and yes, it's twisted, but also that's because the spinal bone, the vertebra, has actually changed shape. If it doesn't quite grow at the same speed, it can change. And then with just gravity and physics and the way the body works, it'll just keep that weird shape. And then the body has to compensate for it. And then it's a cascading effect. So that's why it gets worse. But if you can put something in place to take the curve away and change it, then you can actually see some improvements. If you like big words, de novo scoliosis is actually the name of the degenerative-based scoliosis in the older population. We do know that early and accurate detection leads to the most appropriate treatments. It could be a difference between a patient needing surgery and not. And even for adults, if we find out there's a scoliosis, there's things that we can do to help with the appearance, posture, pain, or balance. All of these are reasons why people seek out treatment. So it's not always pain. It could just be appearance. The Scoliosis Research Society, SOSART, they do say early detection and non-surgical management is the best way to go. All right. Most schools do not have a consistent formal screening program. Some people can remember a nurse or somebody lines you all up and you bend over and then they check your spine. Now, a lot of times it was even with a shirt on, and really you want to have a shirt off to even see these things. That's why summertime is kind of nice because you see people in bathing suits and, oh, man, something doesn't look quite right. And that's when you notice it. So now let's do an assessment. The first thing you want to do is have them stand with their feet about shoulder width apart and let their arms dangle to the side. And just going to look at them. Like I said, without a shirt, it's easier to see these things. You're looking to see if one shoulder is higher than the other. You're looking at the shoulder blades to see if one pops out more than the other. You might actually see a curve in their back to begin with, or one hip is higher than the other. Or you might see that one seems like it's pushed forward on one side. Sometimes it's like shadows and just the way the body is shaped. You see that. And in the stomach area and the low back, you might see like this crease on one side that you don't see on the other. Then you want the feet together, knees straight, palms together in front of them, and then they bend over. And here, we're looking at either side of the spine. You may find that there's like a hump. So it's higher than the other side. You can see that in the thoracics where the ribs are, or you might see that if you bend over a little bit further in the low back and the lumbar. That's a very classic sign. In fact, there's an app we'll talk about later. If it goes past 6 degrees, definitely indicative something's going on. Get some films, probably have scoliosis. So that app is called app.scoliescreen.com. app.scoliscreen.com. It's free. It's got 8 simple questions, and you can use it anytime. And it'll run you through what I just told you with a visual picture of what you're looking for. And you just answer yes or no. And at the end of it, it spits out a score. And if it says medium risk, high risk, then it advises you to go find somebody. And then they have a webpage where you can find a doctor near you in case you hear this podcast and you're not in the 3 or 4 state radius of Louisiana at the time of this recording. Again, large curves are once small. Unfortunately, some people don't even notice it. Maybe they're 15 years old. They see something going on. They get a film. It's like, oh my goodness, my daughter's at 35 degrees. Well, how come nobody noticed it? And it happens. And sometimes they don't have much going on. They have a big growth spurt, and that curve just gets really bad really fast, 6 months to a year. So that's why it's important. If you see it early, you have to at least have films from time to time to see how it's looking. If you have a strong family history of scoliosis, it might be important, even at a 10 degree, to get on a brace so you can capture it early so it doesn't have a chance to get bad. But in general, like we said, if it's less than 10 degrees, we're looking at massage adjustments and the postural exercises to help straighten that out. And we can see how you're doing over a span of time. But once it's higher, we're looking at braces. When you're an adult, you don't have to wear it part-time. 5 or 6 hours of wear. As a kid, you got to wear it like 23 hours a day. You can get about 3 hours of break if you play sports. Some research says 13 to 16 hours, but then there's more of it that comes out. It's like, hey, the more you wear it, the better results you get. So that's our recommendation. We have some case studies where you're 13 years old, you have a 33-degree curve. After 22 months of wearing the brace, it goes down to a 6-degree curve out of the brace. One of them was a 3-year-old. It's 40 degrees. In a traditional brace, they only got a 33-degree curve, so from a 40 to a 33. But when you put them in a Scoli brace, after 24 months, it's only a 14-degree curve. So that's a 26-degree improvement when you have the appropriate brace. And that's what's really important. So that's the basic lecture, okay? Give me a little grace here while I work through this next lecture, and we'll go into more details about what makes this brace unique versus another one. I know this talk kind of sounds like, well, he's just trying to sell braces. Well, it's more of like it's with the treatment you actually need. But we'll go through the other things. So for instance, say the Scoli balance, the postural corrective exercises. If you have a right curve in the thoracics or a double curve and the primary bigger curve is in the lumbar, well, there can be different exercises for you. So you're doing these sitting, and we'll have you put you in these special positions, and you have to do those. And as you get better at it, we start doing more activities with it, like raising an arm, or if you play guitar, you play guitar in this special position, doing it in a standing position, not just a sitting position. The Scoli roll, that is a device that you lay on, and it forces your curve into the opposite direction. And so it's all about tendon and ligament creep. After about 10 to 15 minutes of laying on this thing, those structures, the ligaments and tendons are actually able to release and stretch. So the more flexible the curve, the more likely when you do the exercises, you'll see some positive changes where the degrees get better. Especially if you're wearing a brace and you're doing these things. Well, now you're actually flexible, so the brace can actually put you into the position that you need to be in a bit easier. And you'll see better results that way. And like I said, there are certain muscles that we find that get tighter and more contracted in scoliosis that we just want to address. So if you can address those, again, flexibility, the pelvis can get more level, and you can accept the treatment a bit better. Of course, as a chiropractor, personally with scoliosis, I like to use these instruments so we can actually target one side versus the other, and the patients don't have to worry about being jumped on or I don't want to be cracked or whatever. So you don't have to worry about all of that, and you can be extra specific with these instruments. So that's my preference there. Just so you know, if someone's coming in just for pain relief, especially as an adult whose curve is pretty stable, maybe not so big, maybe in their 30s or 40s or 50s, something like that, we can also do a specialized kinesiology taping. We put that on there. It just supports you in a certain way. So you make some postural corrections, and usually between 3 and 8 visits, they're really seeing a big difference. It might go longer, it might go less. It just kind of depends on the person and how they're responding and their activities, their lifestyle, what they do for work. There's a lot of factors that go into it, but that's a pretty standard plan for that. It works quite well. But again, that's once a week. So someone who's coming in from 4 hours away, of course, that's not really going to work for them. So we have to think of other ways to help these people. But if you're local, it's definitely an added benefit. Now, before I move on, a lot of questions we get are about sports. I encourage sports with scoliosis. The only 2 things you don't want to do is competitive level training for ballet and swimming. Can you swim? Yes. Could you swim every day? Sure. But what we don't want is 2 to 3 hours of swimming 4 or 5 days a week. Something to do with the buoyancy and the gravity just doesn't work well with scoliosis. We used to think scoliosis in swimming was okay, but it turns out not so much. Dance, it's the same way. If you're going to be doing 2 or 3 hours of that, the amount of flexibility and the positions they put themselves in is just not great. Can they do some? Sure. They can take a class, learn a bunch of different ways. But again, just competitively, it's kind of a no-no. All right, this presentation is more geared towards the doctors. I'm trying not to repeat a bunch of things, but we'll sprinkle in some new information as well as some old. Early accurate detection is the difference between a fused or non-fused spine. Again, when we're looking at x-rays, we're looking for spinal rotation, not just bending. Here's the prevalences. In children, young children, less than 5 years of age, it's less than 0.5%. Teenagers up to 18, it's only 2 to 4%. When you're over 40, 9% get scoliosis, 30% over 60, and if you're over 90, you can book it, 50% will have that de novo scoliosis. It's not uncommon within 6 months to a year if someone had a 26-degree curve to get up to a 45-degree curve when they're over that 60-plus age. Low back pain is the most common reason why an adult would seek care. Of course, it'll be in the back. It'll be the side that has the biggest curve. It could be on the convex side, which is the way we classify curves. And there's always one area that's like the most pushed over. We call that the apex. And so a lot of our treatment is based around where that apex is. And you can have pain in the front of the leg. For children, they might have some mild pain. And of course, when they're putting on this brace, it could be somewhat uncomfortable to start with. So reasons to be treated, you can pain, cosmetic deformity, balance control. And if you're looking at having a surgery as an adult, it's mostly for pain relief. And you'll find that a lot of the surgeons are not excited to do these surgeries because of the risks versus the reward. Research is showing that bracing for adults is an interesting treatment option because it's an alternative to surgery, especially for those who don't qualify but still have a lot of pain and don't want to take narcotics. So what are they supposed to do? But like they said, the nice thing is they're looking at 5 or 6 hours of wear versus 20 plus, especially for an adult, an older adult that is. Are we trying to go from a 45-degree to a 35-degree curve? Not necessarily. We will see those things, but it's about supporting the body in a different way so that they actually can have the pain relief. And surprisingly, with the brace, some people say, oh, you're going to lose your muscle strength. Well, that's true if you're doing like a back brace because you hurt yourself. But there's some play in the brace so you can move and you're doing the exercises. So they actually have a couple of tests, endurance tests that you can do, and those will get better as you wear the brace longer. So that's really exciting that you're not going to lose muscle strength while wearing it. And when you bend over and you use a scoliometer, they do have a scoliometer app that you can download as well. Just type in scoliometer. And if you see that it's 5 to 7 degrees of deformity, so the degrees is 5 to 7, then more follow-up is necessary. They should be screened twice for females at age 10 and at age 12. And at males, at 13 and 14, they should be screened. Because when you have that rib hump on one side, you're pretty much going to have a pretty big curve that we have to deal with. In the lumbar spine, you're looking at more 4 degrees and more is the problem, just so you know. I'd say a big reason why 20 and 30-year-olds come in is because of cosmetics to start with. They might have had a curve that they wore a brace for as a kid. They took it off and they find that they still look different or they're having a little bit of pain, either one. And so now they're here hoping, what can we do? So you can try the standard treatments, and then if it's still not working and they're willing, then you can put them in a brace. And you can still see some changes, some big changes at that age because it should still be flexible and movable. And, if you can get a 30-degree curve down to a 20-degree at a younger age, well, we know it's going to progress about 1.5 degrees a year. So when you're older, it's going to be a problem, right? 20s and 30s, if you stay in shape, don't gain a lot of weight, stay active, you might have somewhat of a stable curve for a long time. But after a while, gravity, old age kicks in, middle age, all that, and it will progress, like I said, between usually average 1.5 degrees a year. At some point, things are going to happen. So if you can get it smaller now, you'll be better off in the future. Again, typically the curves in the thoracic are right-sided. So if you have a left curve, we have to be more careful about that. Pain is not so much common in teenagers, so if they have that, we want to rule that out. Night pain, and for a lot of things, is a red flag that you want to rule out. Why is that happening? It's less common in boys, like we said. One of the ways to follow up is doing an MRI in that area to see what's kind of going on. When you're very young, like less than 7 years old, and you're diagnosed with scoliosis, it wants to be addressed because they do have a mortality rate increase, but not so much if you're an adolescent. Teenage years, it's fine, but it's really low. You want to take more caution. That way you don't have any respiratory or heart cardiovascular issues from that. So spinal manipulation, aka the chiropractic adjustment, is not effective to stabilize or correct scoliosis. Yes, it increases the joint movement. Yes, that turns off pain, increases blood flow, and overall has great positive effects. But as far as helping the curve itself, it's not going to do much. They had a study, at least 13 hours a day of brace wear, you had a 90% chance of avoiding surgery. 90% chance. And then they noticed the longer you wear it, the actual better results you get as far as getting the curve under control. Awesome. They did a study of 242 people. Roughly half were braced, half were not. And the trial was stopped early because there was a 72% efficacy or good results with the brace compared to not. Now, a lot of times these things happen when you're discussing, say, medications for heart disease. They would plan to do a 5-year study, but after like a year and a half or 2 years, those who get the medicine versus those who don't have so much better results, and they're not having heart attacks and all this stuff. So they're, hey, it's unethical to continue this trial. We already see the results. That's what we're talking about when they say the brace is working to help reduce the curve. Well, let me just say this. The traditional brace, this is how I look at it. They open from the back, so they're hard to get in. Ours open from the front. It's also a 3-point pressure brace. So I look at that as you got these 2 2x4s. They're holding you in place. And while you grow, you're just kind of bumping into it. And there's a little pad to kind of help push you. Those braces aren't necessarily built for correction. They're just built to prevent it from kind of getting worse or getting to the worse enough to where you have to have surgery. So if they can avoid surgery, even if your curve gets worse, that's a success. That's also why they don't really have good results with making the curves better. And so there's a lot of doctors out there that are like, the bracing doesn't work. And so it's the kind of the brace that you use. The brace that we're talking about, the Scoli brace, it's a 3D custom built brace. It's engineering CAD technology, combine that with the x-rays, and it's built just for you. And so it's going to look much like the exercises we teach you. If you're supposed to shift to the right and give it a little twist, and one shoulder ends up being higher, the opposite shoulder ends up being higher, well, the brace is going to be in pretty much that same kind of position. And so instead of, quote, 2x4s holding you in place, this brace is going to put you in the opposite position of the curve. So while you're growing, it's being pushed into a straighter position. So that's why it's so important to wear your brace for a long time and catch it early. So while you get those growth spurts, because we don't know when you're going to grow. If we could and had a magic ball, we could say, okay, you only need to wear it for this week and then that week and then these shifts at school, and we'll cover all the times when you grow the most and you'll be good to go. But that's not the way life is. So you just have to wear it all the time to catch it so that every time you have a growth spurt, you're being pushed into the reverse image of your curve. And that's why we see such good results and curves actually improving. So you really don't even need surgery, but you also got a better curve. All right. So that's one of the major differences. Also, these TLSO Boston braces, these are what these are called that I was talking about, the bad ones, air quote. They're not as effective in large and stiff curves for sure. Cosmetic improvements are moderate. So that's something. But compliance can be difficult because it's difficult to put on because it opens in the back. And it actually has static stabilization. So it's almost like a fracture, the way they put it on you and just hold you in place, and you actually lose your lumbar lordosis. So your low back is supposed to have a curve. You end up losing that. That changes the biomechanics, the way the muscles work, strength related. So there's a lot of inconsistencies that we wouldn't want when wearing this kind of brace. And it's the most common because that's what's kind of prescribed at the hospitals. And at this point, I'm the only person in a couple of states that actually does this brace. There's a lot of people that do it in the United States, but for some reason in the South, not so much. Maybe because of the effort that it takes to treat scoliosis. They're pretty complicated. They're time intensive. So maybe there's something to do with it as well. For some of these braces, when you look at them, like if there's a right shoulder high and you put on the brace and you look at it, you're like, they don't look any different. That right shoulder's still high. There's a little pressure. Like, what exactly is this supposed to be doing? Where, a Scoli brace, it's going to actually push you the opposite direction. So in a year, someone might go from 44 degrees to 29 degrees. 71% of the patients saw an improvement in their curve. And this was a study done where people were refusing surgery, even though they had a 45-degree curve or higher, which again, that's a big curve and definitely a surgical consult is necessary. So those are the ones that found an improvement anywhere from 30 to 40 degrees. So that's really good results. The quality of the evidence needs to improve, but there is more papers coming out showing that bracing is better than observing and doing nothing. After a month of wearing it, you get x-rayed while you're in the brace. If we're not seeing an improvement, then what's the brace doing? You need that asymmetrical overcorrective position. We're seeing things 33 degrees down to 11 after a couple of years of use. Now, the nice thing, again, is adults don't have to wear it all the time. That you might wear it for like a year, whereas kids kind of have to wear it until they're finished growing. When their growth plates have closed, that's when you're like, okay, now you can wean off of it. So it just takes time for kids, but adults, it's a quicker procedure. I do get asked from time to time, what if I already have the rods in my spine? Well, you're probably coming here for pain at that point. Wherever the rods stop, that's where a lot of your motion is going to start. And that's where it's going to wear out faster than usual. And what you can find is that if you did, say, have a lumbar curve and a thoracic curve, and the thoracic spine is the one that got fused, the low back curve is still going to be there. And in fact, it can actually get worse and you start having pain. And so those people can actually get a brace as well. It's going to be built to not really deal with the rod part, but the lower part is where you're going to find the changes in the brace to support you better and get that pain relief. And again, as an adult, we're not talking a long time to wear it. 3 to 6 hours a day, 6 months to a year, see where we are. We do take before and after photos of your posture. So over time, you actually see that the shoulders are more level and you're not leaned over to one side like the before, and it looks better. So for a lot of younger people, especially the ladies, they love that so that they look good in a swimsuit. There's no wrong reason to get treated is what I'm trying to say, whether it's for pain, cosmetic, or you don't want it to get worse and end up having to have surgery. These are all good reasons to use it. But when you wear it, of course, that first month is going to be uncomfortable. You're putting your body in a position that it's not used to. Flexibility has to increase with all the therapies together. And I mean, it's a brace. It can be a little bit hot, of course, as well as it's going to be pushing in one here, pushing somewhere else. And there's ways to make it a little bit more comfortable in, say, the armpit, or when you're sitting, or if your hip is poking out. It's one of those things we can modify the brace, trim things away, flare things out. We want to make it to where it's comfortable enough to where you can actually wear it. And you're sleeping in it, which is something you have to get used to. But people do it all the time. Really love the exercises because it gives you an active part, and it's something that you can do at your desk. It's something that you can do when you're standing. You know, just elongating, not even doing all the translations and rotations, but just practicing how to make your spine stronger. You see huge benefits from it. And it's kind of fun to see people who are like, oh, that's not doing much. And then they do it and they're like, whoo, they're sweating. They're like, oh man, I didn't expect it to be this challenging. And it's like, yeah, you got a bit more familiar with your body because certain positions you've never done. So you have to learn how to do them and then do them correctly and then progress into like harder and harder stances. Even laying on the roll, after a while, one, it gets boring. And so we also incorporate a couple of things to make it, A, less boring, but also more effective. Because like when you move your leg, you move your arm, it fires off a lot of these muscles. And so it's kind of training while you're in that position as well. It doesn't take a lot of trips, which is cool. And then, yes, every 3 months or so, you're going to get x-rays to make sure we're progressing, see how much less the curve is. And of course, if it's not working out, well, we need to address that as well. But for most of the time, like that study said, 71%, you're going to see major results. And the biggest thing is saving you from having to do surgery. If we can stop that, that's usually a really good thing. Because you can always have surgery later. If you're 16 and you got the curve under control, but you're 35 and you're really having a lot of pain and just progress for some reason, well, you can either try conservative again, or I think that's the takeaway. Big curves are once small. They could have been managed better at a smaller amount. But if you're willing to wear a brace, or if you're willing to do the exercises, you have hope. Hope for pain relief, hope to get the spine straighter from the scoliosis, and kyphosis for that matter. I know we didn't talk about that much, but versus a side-to-side, a forward hump, Schuman's disease, kyphosis. We have braces specially designed to pull your chest back and get that relief. Those have different numbers, 60 and 80 degrees. That's whenever you're like, oh, okay, we can't really probably put you in a brace on that. You need to have a consult again. But under that, 40s and 50s, 30s, Schuman's disease, that hunched over look, you get them in a brace, it pulls that chest back. You get a lot of pain relief. And that's the biggest concern when you have that is pain. So it's very helpful for that. Well, look, I think that's it. If you have any questions, you can always contact the office, Justin Trosclair, Scoliosis Center of Louisiana. We're in Lafayette. Like I said, it's not uncommon for people to drive down, fly in, stay at a hotel for a night, and we can get everything done in one day. We ship it off to get made, and then it comes back between 2 to 4 weeks, depending on the production. Reach out, drjustintrosclair.com For now, the number is 337-453-5199. Hope this was educational, but also a glimpse of hope that there's something that you can do. You can avoid surgery. Results are there for those who want them. Reach out with any questions you might have. Very active on social media. On the website, they have all those links. You can DM me there if you need to as well. Try to be very flexible in our hours, as well as giving people the information that they need to make the decision for them. I want to empower you. I want to give you hope, and I hope you have a great day. You listen to a Doctor's Perspective special solo episode all about scoliosis and kyphosis management. Before you go, it's just a few housekeeping items. If you visit drjustintrosclair.com/ecard, it will take you to a page that has all the links to hear the podcast, all 6 books that I've written, the No Needle Acupuncture for 40 Common Conditions, the Small Steps to Improve Health, Food Choices, Exercise, and Life, which takes you from better health, exercise, financial, all in one book, the Chinese Dinner Culture book, 5 language coloring book for kids, and my 2 latest ones, Balanced Success Journal. If you're into productivity, gratitude journals, breathing techniques, being more productive, this is the thing you would want. And then also a kid's book called Finding Home. It's a very colorful book. If you want to do things like buy any podcast swag, like t-shirts, there's links for that. If you want to buy the host a cup of coffee. And also the most downloaded episodes by the year is on here as well. And of course, we did some very specific podcast series. Those links are there. You got free book samples and all the stuff that I recommend. They're affiliate links. Everything from what type of WordPress theme should I use, schedulers, social media management, what software to use for patients, what cloud storage I use, VA assistance, prolonged fast mimicking diet. If you need any coaching on how to fast for 5 days but still be able to eat food, I'm available for you for that, and so on. So again, drjustintrosclair.com/ecard will get you access to all of those things. Thank you for listening. See you next time.